When 5-year-old boy Willie Chang was diagnosed with terminal cancer in 2004, his prognosis was grim: 6 months to live. Willie's parents tried almost everything from Batam to Jakarta to Malacca and finally ended up in Singapore, where they ran out of money. Willie then ended up at Parkway Cancer Center in Mount Elizabeth, Singapore. Dr. Ang at Parkway determined that Willie had been misdiagnosed and his stomach cancer was actually testicular cancer. He gave him a 90% chance of survival. Doctors immediately started Willie on chemotherapy. This put Willie in complete remission, and today he's a healthy, normal 16-year-old. Willie didn't really give up any foods, including sugar, and eats like a normal teenager in Singapore. Willie's story underscores the importance of second opinions and cancer expert doctors. 6 months to live, thriving 9 years later. The Thrive Channel congratulates Willie Chang, ultimate survivor. I am a breast cancer survivor, a blood cancer survivor.
I'm Dr. Holly Lucille, a naturopathic doctor.
I am a mom of a teenager, a basset hound owner, a military wife.
My name is Dr. Deanna Atai, and I'm a breast surgeon.
I am a cancer survivor who is looking for answers just like you.
I'm Deborah Tripathi. I'm a medical oncologist.
What works, what doesn't? Welcome to Thrive with Namrata. How important is the correct diagnosis of cancer? That's one question for you guys. And the second question is, does where you get treated matter?
The correct diagnosis is crucial because we need to know exactly what type of cell we're treating, and especially as treatments get more targeted. Now there is some research that we're finding that certain, say, subsets of breast cancer respond to the same treatments as ovarian cancer, but it's still important to know whether it started off as a breast cancer or an ovarian cancer. So that is absolutely critical.
Yes, and we have better tools at our disposal as well to verify the diagnosis and also to subcategorize different types of cancers based on receptors and chromosomal translocations, which may influence therapy. Testicular cancer is highly curable even after it has spread. And it's not that common, so I think for that type of cancer it probably is good to go to a specialized area where they see a lot of those cancers. I think that most cancers can be treated in community centers as long as they are treated by people that have the right credentials and ideally work in a multidisciplinary setting where they can work with surgeons and radiation oncologists. And fortunately, more and more oncologists and surgical oncologists are working together in these centers. When you have a less common cancer like a leukemia or a sarcoma, then you really should go to a center of excellence where they see a lot of those, because there it's critical that it be treated in the proper manner.
I think the most important thing I have to say about where to get treated is that the patient themselves is a real figure part of making that decision. I think that's really important.
Keep everybody involved. Yes. Well, Willie, thank you for being an ultimate survivor and ultimate thriver. We'll see you next week.